Okay, so osteoarthritis is the wearing away of the covering of the bone, the cartilage. That cartilage doesn't have a blood supply and it doesn't have a nerve supply. So if it doesn't have a nerve supply, why does arthritis hurt? Well, it doesn't as it's wearing away. It's only as it exposes the bone, like an electric cable. As long as I can start wearing away the covering of the wire, but as long as the wire's not exposed, I'm probably not going to get zapped. The more we expose the wire, the more we expose the bone, the more chance you have of getting pain. The covering of the bone doesn't have a blood supply, so if it doesn't have a blood supply, how does it get its nutrition? From the fluid that's inside the knee. Every time you take a step down, it squishes out the old fluid, take the pressure off, it sucks in the new fluid. So all day long, like a sponge, the fluid's moving in and out. That's why motion is good for a joint. But after the age of 13, the body can barely heal itself or maintain itself, but the body doesn't know that. So as you get more arthritis, the body says, my cartilage is damaged, I need to fix it. How do I fix it? I need to give it more nutrition. How do I give it more nutrition? I give it more fluid, the knee swells, more pain as it stretches the tissue. So how can we control that? Well, we can keep the weight down. Too much trauma, too much traffic on a road causes it to crack and buckle. So for every pound that you lose 4 pounds of stress. So keeping the weight down helps maintain the cartilage. Exercise helps maintain that cartilage. Motion is good for a joint. It's got to get that fluid moving in and out of that cartilage. But as we get into the winter time, it's a little harder to move, harder to get out. So it's easier to go maybe to a gym or the Y or something to do the exercise inside. Because like a car engine, in the cold weather, it's hard starting in the morning until it's rough, until the oil gets up into the engine, gets heated, lubricates all the parts, and then it starts to feel a little bit better. That's why a lot of our older patients tend to travel to the south in the winter to maintain their joints. So you're going to exercise, more exercise inside than outside, keeping the joints warm so they stay nice and lubricated, keeping the weight down, eating healthy. Avoid rugs and other things that you might trip over in the house. But flexibility, mobility, strength, those will all help maintain the joint a little bit longer before having to come and see us.